for the patient with recurrent primary hyperparathyroidism, it's very important that the diagnosis is correct. So for these patients, you have to go through all the clinical workup. You have to be sure that the diagnosis is correct. You have to be sure that familial hypocalciuric hypercalcemia has been excluded by measurements of urine or genetic testing. And then you have to go through all the remaining records from the previous operations, pathology reports, and so on, to be sure what has been seen, what has been removed, and what may be left behind on the neck for the future surgery. And so if then you decide to go for a surgical treatment, you must also be sure what you are going to take out. You have to exclude some kind of ectopic glands, and you have to maybe do a second scan of the neck. It could be either a new systemic scintigraphy, or it could be a PET-CT, 4D CT scan, or so on, to be sure what you are going to resect in the second operation. And then finally, you have to acknowledge that there are higher risks at recurrent operations. So you must refer this patient to a center with high volume or high experience, because of a high risk of failure, high risk of complications in secondary operations on the neck. So there are many things to look at and to evaluate before you do the second operation. And typically, this patient must have some kind of complications to the surgery. They must be ill or have more disease, and you must, have a higher levels of calcium before you reoperate patients, and or osteoporosis, kidney stones, some kind of affection of the disease before you reoperate these patients. As a surgeon, when you go in for the second time on the neck, it's very important what has been done in the initial operation. And there's not one specific surgical approach that you can use for all these patients. Sometimes you have to do a bilateral exploration. Other times you can use just a focused procedure. But it's important that these second operations on the neck are performed by surgeons with a lot of experience, and also with the adjuncts with intraoperative PTH measurements, nerve monitoring, and so on. It must be a high volume center with expertise in reoperative cases. So there's not one specific procedure, but you must have all the variety of cases at hand, and the expertise. That's really the main target, the main thing to have a successful operation.